Well, good morning, ladies and gentlemen, and welcome to Georgetown and to another in a series of public conversations about religious freedom in the world, sponsored by the Religious Freedom Project of Georgetown's Berkley Center for Religion, Peace, and World Affairs. I'm Tom Farr, director of the Religious Freedom Project, and I'm pleased you're here to join us in what promises to be a robust and hopefully informative conversation about one of our country's hottest and most consequential topics, namely the question of religious freedom in the United States and its status in light of the HHS mandate on contraceptive and other services. Before I introduce Michael Kessler, our moderator for today's discussion, let me say a word or two about the Religious Freedom Project. Our goal is to frame and conduct an ongoing, lively, and fruitful conversation about the meaning and value of religious liberty, both in the United States and internationally. Our premise is that the subject is of vital importance to all of us, but that it has not received the kind of sustained intellectual attention that it merits from scholars, the media, and policymakers, either here or abroad. The blue brochure which you have will tell you about how we approach this subject, give you some information about our outstanding team of international and interdisciplinary scholars, tell you what we've been up to over the last several months and some of the projects that we have scheduled for the next few months. Last November, for example, we had our first public event entitled "What's So Special About Religious Freedom?" And it featured a fascinating debate between Judge McConnell, who's here with us today, and Professor Noah Feldman of Harvard Law School. You can view the video of that debate on our webpage. It led, among other things, to a further debate in the pages of the New York Times on the subject that we're going to discuss today, that is, the status of religious freedom in the United States. We've got copies of that debate for you as well, if you're interested. One of our most recent products is a powerful new book by Tim Shaw, who is the Associate Director of the Religious Freedom Project, and the book is entitled Religious Freedom, Why Now? Defending an Embattled Human Right. I believe there are copies available for you here if you'd like to take them. The book explores the entire range of subjects that are implicated by religious freedom: theological, philosophical, and moral, anthropological, legal, but also political, economic, social, and strategic. I think you'll find it interesting. It is, in short, the kind of work that we are asking our scholars to do and the kind of intellectual scrutiny that we hope to bring to bear on this important subject. Finally, let me mention two events that are on the horizon that may be of interest to you. First, next month in Magdalen College, Oxford, we'll convene a conference entitled Religious Freedom and Equality: Emerging Conflicts in the United States and Europe. That conference will include 3 panels of experts, one from North America, one from the United Kingdom and Ireland, and a third from continental Europe. You'll be able to view that on our webpage shortly after, probably in late April. Then next September 13th, you're all invited to a public symposium here at Georgetown on the subject of Catholic views on religious liberty, featuring a variety of Catholic speakers and a keynote address by the Cardinal Archbishop of Washington, Donald Wuerl. So let's get started with today's exciting discussion, which will be moderated by my colleague, Michael Kessler. Michael is Associate Director of the Berkley Center, a visiting Assistant Professor of Government here at Georgetown, and an Adjunct Professor of Law at the Georgetown University Law Center. Michael works in theology, ethics, and the nexus of law, politics, and religion. He received his PhD from the University of Chicago, where he was a William Rainey Harper Fellow, and his JD from Georgetown University Law Center. Michael, over to you.
Thank you, Tom, and thank you to the panelists, and thanks to each of you for coming this morning. I'm excited for the conversation. I'm excited for the debate that we will have. Our discussion today is part of a wider conversation about important issues of healthcare, needs and costs, individual autonomy, and contested social and personal goods. The panel's focus is one slice of these issues: the claims about violations of religious freedom that have been raised under the regulations implemented by the Department of Health and Human Services under the Affordable Care Act. I think it's safe to assume that you're familiar with most of these debates, but I want to remind us of a few important facts along the way. In March 23, 2010, the Patient Protection and Affordable Care Act was enacted, which made, among many changes, certain changes to federal regulations about health insurance issuers offering group or individual health insurance coverage. In August 2011, the HHS issued an interim final rule under the authority of that law that indicated they would require most health insurance plans to cover preventive services for women, including contraceptive services, without any copay, coinsurance, or deductible. In that rule, the HHS authorized the Health Resources and Services Administration to exempt, quote, certain religious employers, and gave a four-part test that was more narrow than other government tests about what constitutes a religious employer. The net effect of that was that certain kinds of religiously affiliated organizations, Catholic charities, certain religiously affiliated universities and schools, would not qualify under the exemption. On January 20th, 2012, right after Marty and I started teaching a class on conscience exemptions and issues under the law, the HHS issued a statement and further announcement that, quote, after evaluating comments, we have decided to add an additional element to the final rule. Nonprofit employers who, based on religious beliefs, do not currently provide contraceptive coverage in their insurance plan will be provided an additional year until August 2013 to comply with the new law. Employers wishing to take advantage of the additional year must certify that they qualify for the delayed implementation. The responses, which had been growing already to the August issuance of the rule, were vigorous. Most notable among them was Cardinal Designate Timothy Dolan, who was president of the U.S. Conference of Catholic Bishops, who stated, quote, to force American citizens to choose between violating their consciences and foregoing their health care is literally unconscionable. It is as much an attack on access to health care as on religious freedom. Historically, this represents a challenge and a compromise of our religious liberty, end quote. As you know, a vigorous debate ensued. As one of our students put it in a response paper, and I'm paraphrasing, something must be haywire when E.J. Dionne and Ross Douthat are agreeing and saying the same thing. On February 7th, as the reactions heated up, David Axelrod, a senior advisor to the president, gave an interview in which he indicated that the White House was going to look for a way to move forward that both guaranteed access for these kinds of coverages as well as respect the prerogatives of religious institutions. And that announcement came on February 10th, in which President Obama indicated that there would be changes to the way the contraceptive coverage was provided by the insurance companies, trying to distinguish between the religious employer paying for it directly to satisfy how they took some of the objections. The bishops responded to this further with a statement that suggested it needed to undergo, quote, careful moral analysis, and continued to raise a number of objections. On March 14th, they issued a statement after a meeting that suggested that while the bishops were not about banning contraception, which they said, quote, the Supreme Court took the issue off the table 2 generations ago, they instead identified 3 continuing problems with the HHS mandate. Quote, an unwarranted government definition of religion, a mandate to act against our teachings, and a violation of personal civil rights. And then, this past Friday, the HHS released a new advance notice of proposed rulemaking on preventive services policy that seems to indicate further opening of doors and changes to come, mostly centered around the questions of how to provide for the mandate about contraception related to self-insurers, questions about the religious employer definition, among other issues. So it remains to be seen where this issue will go. Yet we are left today with many issues to sort through. And let me clarify some of these issues by indicating a few of the wider issues that we are not addressing. Our discussion is not about the constitutionality of the Affordable Care Act. You can watch next week's marathon sessions at the Supreme Court to your heart's content for those issues. Likewise, we are not debating whether the HHS regulations about preventive services will, in fact, reduce healthcare costs, increase women's health, whether they involve, as a matter of, as a meritorious argument, certain kinds of contraception is defined as abortifacients. Nor are we debating whether the regulations themselves are a good or a bad policy, or assessing their morality per se. Our topic, at once more narrow and yet gigantic, is about the present state of law regarding the free exercise of religion, and how the debate over healthcare has provoked a fresh inquiry into how religious claims of conscience intersect with generally applicable laws. If the government has deemed it essential to cover the kinds of services that HHS has determined are important for public health care, how does it matter if some citizens claim that these services violate their conscience and religious belief and identity? How is a regulation, such as the HHS mandate, a violation of religious freedom? And if it is considered to be, how should the state respond? Does the current state of religious freedom law necessitate or merely allow for accommodations? If exemptions are permissible or necessitated, what are the limits of these accommodations? When a mandate created by the legislature and regulators through the political process is deemed to be an important policy goal, when does that public goal outweigh religious claims for exemptions? This is the basic question I posed to the panelists, and about which each will offer some opening reflections. Let me now introduce each of them briefly, and by brief, there is more information in the program materials that were handed out, and then we can get to our discussion. Each panelist will take about 5 to 8 minutes to lay out their response to that general question I asked, and then we will work through some set of issues that both arise from the conversation and that are generally part of this set of issues. And then we will have time at the end for Q&A. Just a quick note, I saw a number of you do it, but I please ask that you make sure that your cell phone and or other noise-making devices are turned to silent so that we can all concentrate on the issues. First panelist is I'm not the violinist, so I can't play along with that. The first panelist is Helen M. Alvera, an associate professor of law at the George Mason University School of Law, where she researches and writes about current controversies regarding marriage, parenting, and new reproductive technologies. Professor Alvera received her law degree at Cornell University in 1984 and a master's degree in systematic theology from the Catholic University of America in 1989. Among her many activities beyond the academy, she chaired the commission investigating clerical abuse in the Archdiocese of Philadelphia and is an advisor to Pope Benedict XVI's Pontifical Council for the Laity. Martin Lederman is an associate professor of law at Georgetown University Law Center in DC. He recently served as Deputy Assistant Attorney General in the Department of Justice's Office of Legal Counsel from 2009 to 2010. His area of expertise consists principally of federal litigation, separation of powers, executive branch lawyering, and statutory interpretation, and the First Amendment. Lederman received his BA from the University of Michigan and his JD from Yale, and it has been an absolute delight this semester to teach with you. Michael McConnell is Richard and Frances Mallory Professor of Law at Stanford University Law Center and Director of the Stanford Constitutional Law Center. Prior to his role at Stanford, he served as a federal appellate judge for the 10th Circuit and previously taught law at the University of Utah and the University of Chicago. His particular areas of interest and expertise in constitutional law include freedom of speech and religion, the relationship between individuals and the government, and originalism. He received his BA from Michigan State University and his law degree from the University of Chicago Law School. Melissa Rogers directs the Center for Religion and Public Affairs at Wake Forest University School of Divinity and serves as a non-resident senior fellow with governance studies at the Brookings Institution. In 2009, Rogers was appointed by President Obama as chair of the first Advisory Council on Faith-Based and Neighborhood Partnerships. Her area of expertise includes First Amendment and religious organizations, religious expression in American public life, government partnerships with religious and secular nonprofits, and the interplay of religion, policy, and politics. She received a BA from Baylor University and a JD from University of Pennsylvania Law School. So join me in welcoming our panelists and we'll go in the order of Helen, and then Michael, and then Melissa, and then Marty.
Okay. Oh, first. Okay. Do you want us to get up there? Would that be easier?
Whatever you would feel free
I think
doing.
anything to escape this.
I'm not sure.
You know, yeah, I think I'll just do that. I'm going to, instead of stumbling down there. Okay. Well, good morning. I come to you with a perspective not only as someone who's been an employee of a couple Catholic institutions, a professor of law and religion and family law, but who has also acted as an attorney for various Catholic entities. I'm going to be talking about how the Catholic Church might understand the burden placed on their religious freedom by this mandate, in particular its interference with their governance of their internal affairs, and the lack of a rational, let alone a compelling government interest in making contraception marginally easier to access as a response to women's health need, possible evidence of animus against the Catholic position of contraception, and the value of preserving the Church's witness in law via a granted exemption here. So this is really difficult to do in a few minutes, but I'm going to try by presenting a timeline which weaves together information about the Church's constant teaching in this area, how religious institutions have played a crucial role in preserving it, and the correlations between federal government protected expansion of birth control and increased rates of every problem that the government claims that its program is trying to correct. So you know the pill hit the scene in 1960 when non-marital birth rates are about 5%. Much like the federal government today, its supporters proposed it would solve problems like non-marital births, unintended pregnancies, and abortions. In 1965, you know the Supreme Court holds in Griswold versus Connecticut the right of married persons to access contraception, extended to single persons in Eisenstadt in 72. In 1968, Pope Paul VI issues the encyclical letter Humanae Vitae, upholding the Church's constant teaching on contraception on the grounds that it protects the nature of sexual intercourse, this teaching, which is to both bond couples and to create children. The document predicts at that time that widespread practice of contraception will lead to more non-marital sex, the objectification of women, and the likely exercise of a frightening degree of power in the hands of governments who will attempt to impose their will on population to solve certain social problems. 2 years later, in 1970, the federal government gives us Title X, directed to birth control for the poor, although not all of it is means tested. Today, we have about 5 million people, about 30% of them over the poverty line, at 4,300 service centers at an expenditure of $317 million federal dollars, getting birth control from the federal government. To expand on that a little more, you also have Medicaid, which pays 90% of birth control costs for the poor, and many states supplement the last 10. You have the Maternal and Child Health Block Grant, funding 610 school-linked or based clinics. You have community health centers serving 20 million Americans today. The New England Journal of Medicine predicts that'll rise to 40 million, providing birth control on a sliding scale basis. And then, of course, you have the hundreds of millions of dollars given by federal and state governments to Planned Parenthood subsidizing birth control. What's the data regarding the evils the government is anxious to prevent in connection with women's health? It looks like, and these are notoriously slippery figures, but it looks like unintended pregnancies went from about a third in the 60s to about 50% today. Abortions rose to 1.6 million before settling at a plateau of about 1.3 million. And according to a 2008 Department of Health and Human Services publication, non-marital childbearing has increased among every age and social class. Today, it is up to 41% of all births in the United States. Economists and psychologists looking at the law and correlating it with their own theories have said that in addition to the fact that birth control fails regularly, it seems to have inspired a well-known phenomenon called risk compensation, where people are increasingly willing to undertake risky behavior if they believe technology will save them. This has been also correlated in some of the most famous articles on the subject by Nobel Prize-winning economists with a change in the sex mating and marriage market in ways that immiserate women. So back to our timeline. So now, from 1973 now to 2009, we begin with a steady stream of federal conscience protection laws which protect both institutions and individuals from being forced to perform or cooperate with medical services they object to based upon religious or moral conscience in connection with a wide variety of federal programs, mandates, and funding. These protections are very, very similar, in some cases identical, with the protections proposed by the Fortenberry and Blunt bills to respond to this preventive health care mandate. From 1978 through 1982, you've got John Paul II's Theology of the Body, the first 130 Wednesday audiences of that Pope, which is perhaps the most detailed and compelling case for the preservation of the link between sexual intercourse, permanent commitment between a man and a woman, and procreation. I believe the fruits of this continuing confluence of legal protection for conscience and a flourishing intellectual support for the Church's teaching led at that point to a revival of intellectual and pastoral and personal attention to matters of human sexuality, including contraception in Catholic institutions. I don't have time to go through all of them, but one could say, in fact, that in many Catholic institutions, such as hospitals and universities, the refusal to ensure for contraception is the single clearest statement the Church makes in those institutions because it doesn't carry it out in all cases in sort of conversation with employees or patients regarding its positions on contraception and human sexuality. You have documents from bishops, you have study groups, you have high schools taking up theology of the body curricula, you have women's groups, large women's groups, for instance, Endow, which are in dozens of dioceses, promoting the theology of body to a widespread audience of women. This has also borne fruit in Catholic universities and hospitals and other settings where conversations about the Church's teachings on human sexuality have flourished. We now come to the mandate today. It was instigated by recommendations, as was reported, from the Institute of Medicine, which was I don't know that there's any other word for it, a stacked panel of abortion advocates for the largest part, including the Guttmacher Institute, whose 1995 report on what the federal government should do about contraception uses language hauntingly identical to the language coming out of HHS today. This report was issued, and it relied in its recommendation for contraception, early abortifacients, and sterilization on documents published by Planned Parenthood, Alan Guttmacher Institute, and others suggesting that contraception was necessary for women's health, while completely ignoring all the evidence being put out for the last 30 years about the law and economics and the law and psychology of the relationship between government action and the immiseration of women via more out-of-wedlock pregnancies, births, abortions, sexually transmitted infections, and unwilling sexual encounters. It did this in a context where insurance covers covers birth control for the most part. Poor women report they are not denied access to it, and thousands of exemptions are granted to other groups. In fact, it's estimated that millions of Americans will be exempt from the entire health care law, including this preventive health care mandate. So in conclusion, regarding some of the issues that are raised by this factual timeline for our current legal questioning, one is the question about the burden on Catholic institutions. Theologians are writing about this in all over the place right now, about the degree of cooperation that will be required in institutions if the mandate goes through. They are also talking about the fact that there is another question raised by the prospect of all Catholic institutions and individuals in the United States buckling under such a mandate and the scandal that that would give. And then, of course, there is the question of the necessity of fighting the mandate, because the situation today versus tomorrow, if the Catholic Church does not fight it, is a dramatic move from not having to violate our conscience to everybody having to violate it. So this undergirds the argument that we at least have to fight it. There is also the question that even if you set this aside, the government has interfered with churches' constitutional right not to have their internal affairs. The relationship between the employer and the employee intervened with and changed by the government. We are an institution, the Catholic Church, that sees outreach to non-co-religionists as mandatory. The language of Deus Caritas Est, Benedict's first encyclical, says, as a community, the Church must practice love. Love needs to be organized as ordered service to the community. Charity is not a welfare activity which could equally well be left to others, but is a part of the Church's nature and an indispensable exercise of her very being. You also have the question of what it would take for the Church to live like this in the world. They end up having to cooperate with those who are not of their own religion in large bodies, which end up being regulated by the government. There is also the question of the mandate deliberately drawing lines between institutions who feel they must serve the public in order to be who they are as a religion, and institutions who do not feel that way. There is also the final question of the possibility of animus in this. When the government adopts a position put forward in Alan Guttmacher's terms many years ago, knowing the hundreds of thousands of comments that have come its way and they rejected regarding the burden it would be on the Church, knowing the absence of prior difficulties in the populace and with women's health in connection with the Church's not providing this service for the hundreds of years that we have been serving those not of our faith in the United States. So finally, what would be the shape of the conscience protection that the Church is calling for? All religious institutions and individuals, based on the prior experience that we have, not only as a leavening institution, raising questions about women's health and human sexuality that others are not raising, in light of the great burden it would constitute on the churches to cooperate with this, in light of getting the government out of the internal affairs of the Church. Sorry, there's so much in that small bit, but there you have it. Thank you very much.
Thank you.
Thank you to the organizers for putting together this conversation, and I look forward to the interchange that we're going to be having. I'm going to approach this question from a somewhat different perspective than Helen has just offered. I'm not a Roman Catholic. I do not share the Church's theology with respect to contraception. I'm here because of my interest and commitment to religious liberty, and so to my mind, the issue here is not related to the specifics of the mandate, but rather to the unprecedented decision to require not only religious institutions but also other Americans to pay for something that they regard as deeply contrary to their beliefs. And I want to organize my remarks around legal categories. I'm a law professor, not a theologian, and so that's the way I tend to think. There are two bodies of law which are applicable to this question. One is statutory and the other is constitutional. Statutory, the main constraint here is the Religious Freedom Restoration Act, which was passed in 1993, signed by President Clinton. Marty Lederman used to be the fellow in the Clinton administration who was responsible, among other things, for early interpretations and for making sure that it was given its full effect. And that law provides that whenever actions of the federal government impose a substantial burden on the exercise of religion, that they can be sustained only if they are the least restrictive means of achieving a compelling governmental interest. And that's actually how I'm going to organize remarks. Is first, is this a substantial burden on the exercise of religion? And second, is it a narrowly tailored means of serving an important governmental purpose? In addition to that, there is the free exercise and establishment clauses of the First Amendment, which are guarantees of religious freedom. Just a few months ago, the United States Supreme Court rendered a remarkably powerful, unanimous decision reemphasizing the protection that religious institutions have for being able to make decisions important to their beliefs and their mission. A unanimous decision, I might add, rejecting the argument of the Justice Department and this administration that the Free Exercise and Establishment Clause provided no special protection to religious institutions at all. Interestingly, even Justice Kagan, who had been the Solicitor General not that long ago, joined in an opinion emphatically rejecting that argument, calling it remarkable, which is kind of judge speak for really out of line. I wonder if this contraceptive mandate is not a product of the same kind of legal thinking that went into that brief. So let me begin first with the burden. I don't think that there can be much doubt that requiring a religious institution to pay for services that it regards as immoral or evil is a burden on the exercise of religion. That seems to me to be rather obvious. Let me give an analogy, though, just if this might be helpful. I have no doubt that the federal government can, as a policy, make contraceptive services and sterilization and abortifacients available as a matter of federal policy. The analogy here is to making war. I have no doubt that the federal government has a right to have a military establishment and to make war. It can use tax money that comes into the general treasury to do that, even though many Americans have a religious and sometimes non-religious moral objection to warfare. Right? But that doesn't mean that the federal government is unable to pursue its objectives. But what the federal government cannot do is require religious institutions or conscientiously objecting individual citizens to make war for them, right? So that they cannot conscript the churches of America into assisting in the war effort. And throughout American history, we have always provided exemptions for religious conscientious objectors so that individuals do not have to make war contrary to religious conscience. It's not that warfare is not important, right? It's that conscience is important as well. And I think similarly here, It isn't that there's any restriction on the federal government in pursuing its particular understanding of health care services in America. It's that they cannot conscript religious institutions and individuals into carrying out that program for them. And I think that the administration's policy actually acknowledges that that is so, because from the beginning, and even before all of the commotion, the administration exempted some religious institutions precisely on the ground that they did understand that this would be a burden on their religious conscience. However, it only exempted those religious institutions that primarily serve members of the religion itself. And in an initial version of this, they called this houses of worship. And that's essentially what it is the houses of worship exception. As if churches in America did not do things like run soup kitchens, have adoption services, have international aid relief, aid for the poor, hospitals, schools, and so forth, as if churches were only places where people retreat on Sunday mornings in order to talk among themselves. And so I think the administration seems to recognize the burden on the exercise of religion, but wanted to confine this to just to houses of worship. And I think this seems to reflect a view, and if you listen to the rhetoric that comes from the administration on the subject, they actually very rarely refer to the exercise of religion. They speak instead of the freedom to worship, as if that is what religion is about, is worship rather than serving God in all the manifest ways in which religious institutions do so. Well, after the commotion, and under a great deal of political heat, the president announced that there would be a so-called compromise. Now, first of all, we have not yet seen the compromise. The present rule is a final rule. It is in effect. There is a proposed rulemaking which does nothing other than ask people to make comments on how can we possibly provide free services of this sort to employees of religious institutions without anybody having to pay for it. My guess is that Econ 101 will kick in at some point and they will realize, no, that is not a possible proposition. But in the meantime, we have regulations that are final and in place requiring religious institutions to buckle under. But let's think about the compromise for just a moment. As I understand it, the idea is this, that the healthcare policies that religious institutions provide will not themselves have to cover the objectionable services. But the individuals who are covered can call the insurance company and add an additional rider to that policy. Right? It's only by virtue of being covered by that policy that they have the right to do this. They get to add to that policy these additional services at no cost. Right? Now, I submit to you that that is no difference in substance whatsoever, because the policies still cover everything that the individuals are entitled to. That is nothing. I would say it's a fig leaf, but I think that this proposal actually gives fig leaves a bad name. It is sometimes said that the way this works is that providing these preventive services will actually save the insurance companies money, and therefore they really don't need to charge for them. I think that that's a rather bizarre economic argument. And the first point is that if that were so, then we wouldn't have to have a contraceptive mandate anyway, because profit-making insurance companies wanting to save money would be handing out contraceptives for free without anybody telling them to, if it were so. But it's also simply not so. Take, for example, other prescription drugs for which under most healthcare plans, including, for example, mine, which I think is a quite generous one, co-payments are required for all for prescription drugs, and indeed a much higher copayment for branded drugs if you don't use the generic. For some reason, the administration believes that there should be an exception for contraceptive drugs and no copayments. And by the way, no copayments even if you use a branded drug, even though generics are on the market for a cost of, I gather, $9 or $10 a month. This regulation allows users to have a prescription, a branded drug instead at no cost. I can see no justification for that other than possibly a giveaway to drug companies who will be able to profit from that. But take an example that I'm familiar with, which is blood pressure medication. Right, so I take blood pressure medication. If I did not take it, I would greatly increase the chances of having a heart attack, and it would be much more expensive for my health insurance to have to treat that than it would be for me to be taking generic blood pressure medicine. But do they give it to me for free? It would save them money, right? Because preventive care, like my blood pressure medicine, is cheaper than the heart attack that I might very well have if I didn't take it. But no, they do not, in fact, give that to me for free. They give it to me as part of the coverage. It's paid for, and I have a co-payment, which I pay every time that I pick up my prescription. Nothing in life is free. The money is going to come from somewhere, and the only place it's going to come from is the premium that is paid for the coverage. So it seems to me quite clear that even with the so-called compromise, that this proposal places a substantial burden on the religious institutions. So let us then ask, well, what is the governmental interest? It seems to me quite clear that all this is about is cost shifting. That it's, instead of the government itself providing the service that it thinks is important, it's trying to shift the cost onto employers, including religious employers, which is not a compelling governmental interest at all. But how do we, in law, how do we make the judgment as to when interests are compelling? Because it's a very sort of political, subjective question. What we do is we ask, do other institutions in similar circumstances insist upon the same thing? Because if something's truly compelling, then in other analogous circumstances, the government is going to be taking the same view. Well, first of all, many states already have contraceptive mandates, but none of them impose them in the same sweeping, exceptionless way that this proposal does. Most of them allow religious employers to self-insure and thereby not provide the contraceptive coverage. And there are other ways it's dealt with as well. If you look at past proposals, when Hillary Clinton tried to work toward a similar health program back in the Clinton administration, the version of that bill that passed the Senate Finance Committee included a very broad religious accommodation. If it was okay back in 1994 in the Clinton administration, I do not know why it is not a permissible or a reasonable accommodation today. And in fact, if you look at the whole panoply of federal health care laws, to my knowledge, every one of them that potentially might infringe upon religious conscience has an exception. And what's more, even this rule has exceptions that affect millions of people. If it were a compelling governmental interest to make sure that every employee gets this kind of coverage, there would not be, for example, the exceptions for houses of worship. There would not be the exceptions for grandfathered policies. Remember, President Obama promised us that we would all be able to keep our own coverage, right? Well, that means that policies that were in place before have been grandfathered and do not have to be changed to conform to this new law. Literally millions of Americans will still have the same coverage as before with no contraceptive mandate attached. If it is okay to exempt millions of people in order to comply with a political promise made by the president, I suggest to you it is okay, it is not going to be a great problem for public policy to exempt institutions on account of religious conscience, a much more, I think, much weightier consideration. How else could the government achieve this purpose? Because under the Religious Freedom Restoration Act, they have to use the least restrictive means of doing that. Well, they can simply do it by expanding the programs that Helen Alvarez referred to. Title X already provides low-cost contraceptives to millions and millions of people. Let the government expand its programs if that's the purpose, but it should not be allowed to require churches for whom this is a moral evil to do it for them. Thank you.
Good morning. Thank you for the opportunity to be here with you. I'd like to thank the Berkley Center and Tom Farr and Michael Kessler and Timothy Shaw and others who I've had the privilege of working with over the years. I also want to say how much I'm glad to be on this particular panel of distinguished advocates and scholars. And as I look around the room, I just have to notice that we could make probably 20 excellent panels out of those gathered here today, because I see so many of you who have worked on these issues and are experts yourself. So this has the makings of an excellent event and discussion, and I'm just grateful that you're here and look forward to that discussion. Because our time is really short, in this particular segment, I'm just going to focus on the issue of religious organizations in the employment context and try to touch on two important principles here. Professor McConnell has already talked about one of them in some depth, which is honoring the objections of religious organizations to paying for or providing contraceptive services. And the second principle that I'd like to discuss is the court has told the government that when it does make religious accommodations, it has to be attentive to the impact of those accommodations on non-beneficiaries of the accommodations. In this case, that would include women working for objecting religious employers. So let me start with the first principle. In my view, if the federal government forces religious organizations to pay for or provide contraceptive coverage when they object to contraception, it would be not only bad public policy, but would, as Professor McConnell explained, create violations of the Federal Religious Freedom Restoration Act. As he said, that act, and I know many of you here work to get it passed, and it says that the government cannot place a substantial burden on religious exercise unless it has a compelling interest for doing so and is using the least restrictive means, the means that are least restrictive of religious exercise. And this, as was mentioned, is a very tough standard, and properly so, I think, because religious exercise and the ability to practice our faith as we see fit rather than as government sees fit is a fundamental human right. It received greater protection in years past from the Supreme Court, but thankfully now it is protected through a federal statute when the Supreme Court has been less protective of that right. So in this case, as I said, I do believe that it substantially burdens the religious exercise of an organization if it objects to contraceptive services and thus to providing insurance for contraceptive services. And if the government were to force that organization to do so, it would create a substantial burden. And even assuming that there is a compelling state interest in this case in expanding contraceptive coverage as widely as possible, I don't think that would be the least restrictive means of promoting that compelling interest, in that there could be other entities or independent of the religious organization that could provide that coverage rather than having to force the religious organization to do so. Even if this, however, act did not cause what some would consider to be a RFRA violation, and that's the shorthand that I'll use for that statute, RFRA, I think that the government does well when it seeks to accommodate burdens that might fall short of substantial burdens, generally speaking. The government cannot and should not grant every accommodation of free exercise rights or the ones that fall short of substantial burdens, but we do have a great tradition in America of the government trying to do whatever it can to ensure that religious communities can practice their faith as they see fit rather than as government sees fit. So for these reasons, my view was that the original mandate with its very narrow exemption was deficient, both because it would have likely created violations of RFRA and because it was vulnerable to First Amendment challenge. I won't belabor all of my concerns here, but I think the exemption was faulty in part because it was too narrow and took issue with the way that the exemption is framed in terms of factors like an organization that primarily serves an organization that would only be a religious employer if it primarily serves people of its own faith. That is not a good or correct understanding of religious exercise, and so I objected along with many others for that reason. In response to those objections, the administration has announced a revision in its policy. As you know, that policy is still developing, but I certainly welcome the administration's course correction, and I believe that it is an important course correction. So I think that it is not appropriate to dismiss that course correction as unimportant. The administration, unfortunately, has not changed the exemption, despite requests that I've made and others have made to change that exemption, but it has created or proposed a policy that would have the practical effect of broadening that exemption by ensuring that religious entities that are not covered by the exemption, like religious hospitals, social service agencies, and schools and universities, would not have to pay for or provide this objectionable insurance. So I think that the administration has not fixed all the problems, but it has made some important strides. The rulemaking is ongoing and provides opportunities to press some of these issues where those who feel that their religious exercise would be burdened by this accommodation can express their views, and those views can be considered and hopefully met. I will note that while the accommodation was not acceptable to all who have objections to contraceptive coverage, it was greeted with great acceptance by certain parts of the Catholic community, and I think that's not insubstantial. We do have in America different understandings of faith. Even within the same faith tradition, we can have different understandings of faith, and I think it's important for us to remember that there were some Catholic organizations who said that this kind of accommodation would be acceptable and work well for them. The second guiding principle that I just want to talk about is that the government also has to be attentive to the effect that religious accommodations have on non-beneficiaries. And in this case, again, that would include women working for objecting religious organizations. A unanimous Supreme Court most recently in 2005 instructed the government to take this effect into account when it was fashioning accommodations for religious exercise. So we haven't heard as much about this constitutional principle, but I think it is important to bear in mind. Here we have a federal rule that extends certain benefits to most American women through their employers. And in the U.S. right now, of course, we have basically an employer-based healthcare system, for better or for worse, and I happen to think it's beginning to think it's more for worse than for better. But putting that to one side, we do have an employer-based healthcare system in the main. So granting an exemption to a wide array of religious entities could operate to deny those federal benefits to many women who would like to have them. Now, of course, the objectors believe that these benefits are bad or unnecessary, but many others believe that they are good and needed. And I think both views count, and it is the right thing for government to do to seek to meet the needs of both groups. I am not a healthcare expert or a social policy expert, but just because Helen lifted up some of the arguments on the other side, let me just mention a few of the arguments that those who would like to have these benefits mention. Women talk about the fact, and other experts talk about the fact that spacing out births improves maternal and child health and thus strengthens families. There's difference in the literature, but some experts have done studies saying that this extended contraceptive use not only reduces unintended pregnancy, but also reduces the number of abortions. And I think reducing the number of abortions has strong support in the pro-life and the pro-choice community. Are these benefits necessary? Some say no, but others say, look, some of the most effective and reliable forms of birth control are not something you can go into the drugstore and just pick up with a drink or something. They require ongoing doctor supervision and prescriptions or procedures. And so it is important to build the coverage in for those reasons. Many of these same forms of contraceptive coverage are also relatively expensive, especially for women who would not be able to get the benefits. They're is means, but they would not be covered or their needs would not be met by programs like Title X and Medicaid. So here too, I think that is it important, even if these interests on the other side do not rise to the level of something that would be constitutionally or legally required, I think it is important and appropriate for the government to try to meet these needs as well without burdening the free exercise rights. So in conclusion, I'd say that I think it is appropriate, again, for the government to honor the free exercise interest here, the free exercise objections to providing this care, and also to seek to ensure that women of objecting religious employers will be able to receive these benefits that they would like to have. So thank you.
Going to stay seated, but peer pressure. This is a wonderful thank you to Timothy and Tom and Michael and the Religious Freedom Project for putting this together. This is the first of what I think will be many panels, symposia, discussions at Georgetown and elsewhere on these very important issues. I don't think this question is going away. It's wonderful to look around this room and at this panel, and I feel like it is a reunion, as Michael graciously mentioned. Melissa and he and I and others in this room, I just thought I saw Steve McFarland walk in, others have been involved in trying to protect and promote and make more robust religious liberty for a long time, going back to the Religious Freedom Restoration Act and the Religious Land Use and Institutionalized Persons Act. And there's an oddity, I suppose, on the panel here in that we are all, I think, professed and past and present defenders of strong, robust religious liberty rights and prerogatives and exemptions, more so than I think a more representative panel might be. I don't know that that's true across the board. I can tell you from experience within the federal government that there are many bureaucrats who are just busy every day with their own little statutes and implementing them, and then when they're met with a request for a religious exemption, they really don't know what to do with it. It's quite a strange thing for them. And there's a real virtue in RFRA and RLUIPA and statutes of that nature, putting government very well-meaning government bureaucrats to the test of questioning whether it's really necessary and important not to grant religious exemptions where they actually infringe upon religious liberty. And so I think most of us in this room, and certainly on the panel here, share a lot of perspectives, but I guess I'm here to take a somewhat contrary position to all of my fellow panelists on the question of whether, as a matter of law, this religious exemption for any of these groups would be required under RFRA. I have my doubts. I'm quite dubious about that on both of the prongs that Melissa and Michael talked about, both the substantial burden side of the equation and the compelling governmental interest side. But to really put it in perspective, I think it is important. I don't know that we have quite yet, Melissa started to sketch out, and Michael at the outset did, where we stand here and what was done. So in the affordable health care, I just want to give a little bit of background on this, and if I make errors, please tell me about it in the Q&A, because I'm just learning all this myself in the recent weeks. In the Affordable Health Care Act, the Congress delegated to the Secretary of Health and Human Services the responsibility of deciding what preventive care should be covered by employer health plans. And the Secretary, in turn, depended upon a study by the Institute of Medicine, part of the National Academy of Sciences, to determine which forms of health care, preventative health care, would in fact improve women's health care in particular. That women were spending a great deal more on health care expenses that were uncompensated, and they had to either make a copay for or weren't covered at all under insurance plans that their employers were providing. And the Institute of Medicine, after studying this, concluded, and the Secretary has adopted that conclusion, that in fact women's health and the health of newborn children when there are unintended pregnancies would be greatly benefited if women had access through their employer plans to contraceptive services and the birth control pill and other and sterilization and other forms of contraception in particular, without having to make a copay. And so that's where the science as determined by the federal government and the Institute of Medicine have come down on it. That's not to say that everyone agrees with that. Helen doesn't. That's perfectly legitimate and the like. But the federal government has come to the conclusion based on what I think is a fairly substantial consensus, although not complete consensus within the society, that the use of contraception is not only a good thing for many other reasons, but actually greatly improves women's health. For many of the reasons Melissa said, we can get into more of them later, but in particular, even for reasons not related to unwanted pregnancies. The contraceptive pill actually helps many women prevent many diseases of great importance. I had some of them written down here. But in any event, those determinations were made, and I do want to say that I don't think there's anything nefarious about this and the idea, let alone haunting, that the United States government relied upon that the Institute of Medicine and the Guttmacher Institute. I don't think there's anything dubious about that at all. And certainly the idea that this administration, or any administration, quite frankly, was motivated by animus toward the Catholic Church, I really don't think deserves a response. I don't think there's any evidence for it, and I think all of the evidence is to the contrary. So what happened? Well, the administration was met by some objections from groups, in particular the Catholic Church, that said, we have a sincere religious moral objection to the use of contraception, and we're uncomfortable as employers in providing that in our plans. They made claims that there was a substantial burden on their religious exercise. And the administration at first basically took a cue from what the states had done. California and New York in particular, and several other states, had adopted a four-part test for exempting certain religious employers. And I'll be honest with you, I'm not especially keen on all four parts of this test. I'm not sure where it came from, how it was developed, and the like, but it seems to me that at least two of the criteria, namely that you be a certain nonprofit organization entitled to certain tax-exempt status, and that you hire only co-religionists, are wholly legitimate and very much tailored to the sort of exemption that the states and later the HHS came up with. The other two, I think, are more subject to debate, and as Michael suggested, HHS is open to discussing whether the criteria that they've developed should be retained. And those two are that the organization, I think, has to be primarily, I forget what the adjective is, devoted to the inculcation of faith, and that it only serve people within its own faith-based system. I'm not sure how those two criteria, I have ideas, but those two criteria seem to me much less well tailored to the reasons for granting the exemption in the first place. And I think that a debate about them is very much warranted. But in any event, the states had adopted this four-part test. Religious organizations, Catholic Charities in particular, had challenged them in court as being violative of religious freedom and had uniformly lost those cases in the highest courts of the two most populous states in the nation in particular. And so HHS basically was piggybacking on what they saw as a test that had survived scrutiny under the sorts of standards that we've been talking about here today. And quite frankly, I think it would as well. Now, they were met then by Melissa and many others within the Catholic Church and outside it in suggesting that these four factors and this exemption was not especially well tailored to protecting religious liberty or religious objections, whether you think there's a substantial burden or not. That there was room to make greater exemptions or to tailor it in a different way by expanding the exemption or coming up with different means of promoting both interests that HHS professed, I think genuinely, wanting to advance, namely protecting women's health and honoring religious discomfort, if not burden, at being involved in this sort of thing. And so just yesterday in the Federal Register, the so-called Obama compromise was spelled out in a bit more detail, and this is effectively what the administration is proposing to do. When I say proposing to do it, it's not even yet a proposed rule. It's an advanced rulemaking process. They are encouraging everyone in this room and who's listening to this discussion and many others to come forward and give them all sorts of ideas about how this can best be done so as to advance both of those goals. But here's the basic outline of what they suggested might work, subject to further discussion. It would be the following. It's still a two-part, it's a two-category, structure, and I'm not sure why they're adhering to that. It might be better just to do one. But these organizations that satisfy the four-part test are still completely exempt from contraception coverage, not from other coverage, by the way. So it means, for instance, that Jehovah's Witnesses and Christian Scientists and other religious groups or employers who might object to other forms of preventive or other care, or for that matter, many people who are have sincere moral or religious objections to the employer mandate and the individual mandate and the ACA generally, do not get an exemption, but these groups do. And then this second level of protection. The second level of protection is the following. Instead of these other nonprofit groups with religious objections to the mandate having to provide it within their plan, the insurer itself with which it contracts will separately, Michael, not in the same plan. The employer will not have to pay for it, contract, or anything else. The insurer itself will provide a separate plan and notice to the employees and to the women that they are entitled to get it directly from the insurer without any involvement of the employer. And in that way, now the government there is a big question, I think a statutory question of the authority to do this that I haven't looked into at all. But assuming they do this, the theory here is quite frankly that this will not impose a cost on the employer or on the insurer. Now Michael objects to that. He thinks that's wrong, but the Department of Health and Human Services has concluded that that they've depended on the views of many experts that in fact, and this isn't counterintuitive to me, that preventive health care in the long run, providing it does decrease the cost to insurers overall of at least some forms of preventive care. They will end up paying less, right? They will pay less if people don't get pregnant than if they do, and therefore it is in their economic interest, and therefore no one, according to HHS, is actually subsidizing this at all. Now that might violate Michael's Econ 101 principles. I am not an economist and couldn't tell you that, but the United States government has concluded that that's the case. We'll see. I mean, we'll see whether insurers are willing to do this or whether they complain that it's costly and whether they're willing to do it. But the employer will really have nothing to do with it. So that's the compromise. There's more details about self-insured plans and about administrators doing it rather than the employer. We can talk about that in the question and answer session. So it's a two-pronged accommodation, I think a very generous accommodation, two-pronged accommodation, to make sure that employers are nowhere near the payment or the support or the sponsorship of contraceptive care if they have religious objections to them. Now, I think personally that this is a good thing and a salutary thing, and I agree with Melissa, it was good for the administration to do it. But I have to say that I don't think it's legally required, and I don't think it would have been legally required to provide any exemption at all. I think Melissa and Michael and Helen will agree with me that the history of cases under both the Free Exercise Clause before the court stripped it to its core and RFRA after that, in case after case in which persons have objected to the use of their money indirectly being used for something that they find sinful and wrongful, has not required an exemption to those laws. And it's funny to me that Michael raises the analogy of war. It is not the case that the Constitution or RFRA requires an exemption to someone going off to war. Congress provided such exemptions and was constitutionally required to extend them to people who were opposed to all war on non-religious grounds, for that matter. But it is not the case that you cannot be compelled to support the war effort. We all do. All of these Catholic employers do. They pay tax. Those that pay taxes do support the war effort, right? Our resources are used every day in ways that I'm confident every one of us in this room thinks of as immoral. There are things that my government does that I think that I'm opposed to, and I can't stand the idea, and I'm morally opposed to the idea of my tax dollars being used for those functions. And that's true for all of us. And it was true for these employers as well before this mandate kicked in. They knew, these employers all knew, that their salaries that they were paying to their employees were being used for their employees to use contraception, as the vast majority of them do. They were paying taxes that were being used for the government to pay for contraception that they disagreed with. And quite frankly, I am having a bit of trouble understanding the claim of substantial burden, although I think there has been, Helen's absolutely right, there has been, this very thing has prompted a lot of really useful and helpful, to me anyway, thinking and writing about what the nature of the burden is when one's money is used in an indirect way with an intervening private choice, in fact, several intervening private choices, between the money. It's not like the employer said, here's money that we want you to go out and use to engage in premarital sex and to use for contraception. The employer sets up a plan that covers 10,000 things, and individual employees, unbeknownst to the employer, will choose or not choose to use it for contraception or something else. And the employer isn't supporting that any more than it is with its salary dollars or its tax dollars. Now, there might be a little bit more of a proximity in the money in some cases. It's case by case. And there's interesting questions about proximate material cooperation with evil that have, as Helen suggests, have engendered great debate within the Catholic Church and elsewhere. Very useful debate. But I think this, on almost any case, this doesn't really seem to me to be much of a substantial burden. And like I said, in every court case that has raised similar issues, the courts have rejected the claim either on the ground that there was no substantial burden, a Ninth Circuit case about student fees being used for abortions, or on the ground that the state could not have possibly afford to grant these exemptions as a matter of law, because it wouldn't just be this exemption, right? If HHS had to grant this exemption, it would have to grant an exemption to anyone who has a religious objection, presumably, to any part of the mandate. It would be blowing quite a huge hole through women's health care from their employer health care plans. Now, it's absolutely right that the government could do it itself in some ways, I suppose. But I am very confident that on both prongs of I'm less confident on the substantial burden prong because the courts can be very deferential on that prong. But I'm confident that if given the previous case law on these questions, the legal claims will probably not be successful here. Now, having said that, I agree with Melissa that I think this is a good thing, and I think it's really important to describe with accuracy how far the administration has bent over backwards to try to be very sensitive to these religious objections. And I think it has, and I think this new compromise holds out the promise of being something that should give great comfort to most in the religious community who have deep and sincere objections to the use of contraception and to their association with the use of contraception by their employees. There's much else to say about this and about the details of these legal and and administrative points, but there's plenty for us to talk about in the Q&A, so I'll leave it at that.
Well, thank you. I think you see there's a lot to talk about just in even the narrow issue as I've asked the panelists to address it. I propose that we talk about three separate pieces of this. The first, I'd like to focus a little bit more on this question of the substantial burden and the burden that is purported to be an impact and a harm upon religious observers. And in the HHS case in particular, which will probably be what we focus on, but this is a longstanding question in the last at least 40 years of constitutional law about free exercise of religion, particularly the question of when should religious practice or belief be accommodated in some manner. Then the next question that I think that I would like to then throw into the mix is, what do you do about that when the government interest is purportedly very high? In this instance, the result of a democratic political process. At what point, where do we draw the line between those sorts of public policies that rise to the level that even if they impose a substantial burden, the compelling interest the government has is so substantial it overrides religious freedom? For instance, in racial discrimination cases, that has been a line that the government has said, you don't get a religious exemption in general for that. And then the third big question, I think, is if there is a substantial burden and there is a government interest, but we're not sure it rises to the absolute level requiring complete deference to the public policy, what do we do about it? When do we grant an exemption, and under what conditions, and how far does that go? So the first question, I think, is about this different characterization of the kind of harm and substantial burden that something like the HHS mandate imposes. I think Marty and Michael, all of you posed a different characterization, and I'm sure that you all have things to respond to each other about. So Marty suggested that your characterization of the substantial burden was probably not going to win in the court. Why would that be? And how would you respond to that?
I'm actually not sure of that.
You're not sure about that, but
courts tend to skip over that, basically assume a substantial burden and go right to the compelling interest test for fear of getting involved in adjudicating what's the basis for your claim of a burden and the like. What I do think, however, is that I think most courts, it will be lurking in their minds. I think there will be some doubt, some skepticism about the nature of the burden in these sorts of cases, and there have been in the cases that have been adjudicated, because it's not at all obvious why or how this burden can be articulated in a way that's consistent with what these very employers otherwise do all the time, the sort of cooperation by the use of their money or resources or property for things that they find to be sinful. I think the courts are skeptical, but I don't think that would probably come out in the case law.
Helen, Michael?
Well, see, Marty, you say that you don't really understand the substantiality of the burden here, but I think what you are really putting your finger on is that there are differences in degree of connection between what somebody is required to do and the moral evil that they perceive, and that is certainly so. But I think our constitutional tradition has made a few of those lines pretty clear, that we do not have a right to invoke a conscientious objection to the use of general tax dollars that go into the Treasury for things that we disapprove of. Although, in a sense, there is going to be an attenuated connection there, but the tax system could not operate, and I think in general that's on the other side. And then you also use the analogy that these employers pay their employees salaries, and of course the employees can use their salaries for whatever they want, including evil things. But there again, I think our constitutional tradition regards that as broken by the independent action. If I buy you come and cut my lawn for me, and I give you the value of that. You use it for whatever you do. I'm not morally responsible for what you use it for. It is very different to require someone to earmark their own money for a specifically objectionable thing. Now, to be sure, this objectionable thing is buried in 1,000 unobjectionable things, but that doesn't make it any better. It's because the question is, are we going to require religiously objecting churches to pay for this particular coverage? And I think the earmark makes it very different. And I was surprised you weren't persuaded by my war analogy, because I mean that's exactly the point. Is that we do supporting war through taxation. That's on one side of the line. But we can't conscript churches to support the war effort. And indeed, I think there's a free there's a free exercise right on behalf of individuals as well. It's never been a constitutional question, since from the very beginning we have always made that kind of an accommodation. So we don't. It's never had to be litigated.
So you think the religious, just on that point, Michael, the religious exemption in the Rumsfeld versus Fair, the Solomon Amendment, the religious exemption there is constitutionally compelled? Religious school, as I read Rumsfeld versus Fair, if Congress had decided that all schools had to allow the military to recruit on an equal and non-discriminatory basis there wouldn't be much of a constitutional claim against it. I'm in favor of Congress's exemption for the religious schools, but I have a hard time seeing the court saying that that's constitutionally required.
Well, I'm not sure that I'm not prepared to talk about Rumsfeld v. Fair. I'd like to know the details of that before expressing an opinion about it. And Melissa is certainly right that not every religious claim gets accommodated. But to tell the Roman Catholic Church that they have to provide coverage for for abortifacients and contraceptive care is a pretty dramatic step.
Melissa?
Yeah, Michael and Marty are focused now on the aspect of paying for. When is an organization actually paying for something to which it objects? The other aspect is related, but provide the plan to which it objects. And when the initial policy came out, it seemed to me, although it didn't get lifted up too much in the debate, that a very important part of the substantial burden was to say to Catholic charities, you have to hold out to the world and to your employees a plan that includes coverage for things that you say are immoral. So you're on the one hand having, I think actually John Garvey put it well when he was saying it makes us look like hypocrites, because we're saying on the one side we preach against this, on the other side here's your plan and here's your benefits, and this is something that we think is essentially an endorsement of something in another breath the group would say it objects to. Now, one doesn't have to come down like that, but that's the way some Catholic organizations approach it. So when the president announced a revision to this policy that said the groups no longer have to present to their employees and to the world a plan that would include contraceptive coverage as part of that plan, I view that as important and substantial in terms of influencing whether there is a substantial burden or not. And I think a number of Catholic groups viewed that as important as well. So that's one aspect I just wanted to lift up.
Right, so part of the issue here is how much in the chain of causality the religiously influenced employer is bearing. That was certainly at the start of this the primary issue. Over time, as the chain of causality has been attenuated, it has become more and more nuanced about what the characterization of the harm is. Helen, do you have more about that?
Thank you. That's the perfect bridge, because I think initially a lot of the moral theological debate about the first claimed accommodation regarding insurance companies are just going to provide this for free. There was the economic objection, yes, that was silly because there would still be payment by the religious institution for that policy to which these services were inextricably connected. Then, as of last Friday, and I guess you said that was published yesterday, Marty, yes, the HHS comes out and says, we're thinking about rulemaking in the future and want your comments about the possibility that the government will create these entities. I've never seen so much effort put into covering, something that's $10 or $20 a month by the government, but we're going to step in and create these entities so that, and they may be funded by donations or by savings from various other aspects of multi-state plans or some other savings, and these self-funded independent organizations, and now here's where we get back to the interference with internal affairs. The initial so-called accommodation said the insurance companies will cover it for free, employees can contact them, and the insurance companies will say, yes, we will provide contraception for free to you. Now what was put out Friday night and says the insurance companies will contact participants and beneficiaries, which by the way has been already pointed out by some, include minor children, minor girls, as well as girls of anyone up to 26 who is covered on their parents' plan, and tell you you have this coverage. So you still have the prospect of a government entity coming between religious institutions and their employees. And now the latest so-called accommodation says that entity will reach out affirmatively to your employees and their children, all of the beneficiaries, and speak to them about this. I think initially the administration was trying to respond to the arguments that paying equals cooperation, but they haven't responded adequately to the question. And
to which
it's hard,
question?
that's what I'm going to finish, to the question, and I think this is a difficult one for them. Theologians are finding it tough to spell out. Leaders of Catholic institutions are finding it hard to spell out. What does it mean when the government reaches into a Catholic university or hospital, et cetera, and speaks directly to the employees and says, we're providing you something, and by the way, it's a woman's right, and by the way, says Secretary Sebelius, people who oppose us are launching a war on women. We're reaching in to provide to you something your institution won't. Isn't that still the kind of very worrisome interference with religious freedom, with the ongoing internal affairs of a religious institution? That's what I think the administration is struggling with the most and presently failing.
Well, I guess I see this differently. Certainly it's appropriate to honor those objections of the employer, but I think with respect to the employees of hundreds of thousands of women of Catholic hospitals, social service agencies, and the like, when there is a federal benefit to which they would be otherwise entitled but for the place where they work, I don't think, and the administration is setting up a system precisely because it wants to be attentive to the religious objections and not involve the religious entity in providing it. I think it's completely appropriate for the government to reach out. And indeed, there really is an important, at least, interest of fairness, I think, when we're talking about a federal benefit, whether one thinks it's a good benefit or not, on one side, for employees to be able to get that benefit and not to have the religious objecting employer block them from receiving it. Now, when you're talking, you can talk about it in many different situations, but I think that that is a legitimate and appropriate thing to do. And I think when you see the administration trying to do gyrations here, what it's trying to do is take the objecting religious organization out of the equation. I don't see evidence that they are telling the insurer to suggest that there's a war on women or that there's something nefarious going on here, but rather simply to offer the coverage, and the coverage can be accepted or denied. And also the religious organization, for its part, as the notice of proposed advance notice indicates, can be quite assertive about its own objection to this kind of coverage. Nothing should or could stop that organization from doing so, and that's appropriate as well.
Well, Melissa, I'm not sure why you call this a federal benefit. A federal benefit is like Social Security or something that the federal government provides for us. What this is a mandatory term in a private employment contract in which they're saying, private employer, Catholic Church, you have to provide this thing to your employees as a term and condition of employment. If the federal government provided this as a federal benefit, we wouldn't be having this conversation at all. What they're trying to do is conscript churches to provide, and other employers to provide the benefit for them. And I think the idea that the church is being somehow taken out of the equation is simply a smokescreen, because when the employee calls the insurance company and gets this coverage, the only reason they can do that is because they're covered by the employer's health care plan. They can't call some other insurance company and get it. It's because they're covered under this plan, and this is simply an unstated term of the plan. And to say that that's free, it's like when you go to McDonald's and you buy a hamburger and they don't charge any more for the ketchup, right? But you're not getting the ketchup for free. What McDonald's prices the cost of the ketchup in with the cost of the hamburger, and that's exactly what this is about. I think it may be, I think most of Marty's comments are equally applicable to the first version as to the second, but I just think the second version doesn't do a thing.
So it seems to me, so far already, in 10 minutes, I think we've heard articulated, and this is typical of this, at least 4 forms of the religious objection, all of which are sincere and genuine and important, but all of which I think have different responses, and some of which are more addressed by certain versions than others. So the first was, our money is being used for something that we find to be sinful, and that makes us complicit with evil. And I don't think that's really the heart of the claim here. I'm not saying no one sincerely believes that, but when I've pressed upon it, and I am very much an outsider to those religious discussions, I have found that there's not a lot of support for this level of attenuation, even before the new compromise, but certainly with the new compromise, I doubt anyone would say the employer is complicit. Well, then there's 3 other things. Helen talks a little bit about just the federal government being involved in the relationship between a religious employer and its employees. I think that's worth discussing, but that is a much, much broader claim. Of course, the federal and state and local governments impose a huge array of requirements that regulate the relationship between those employers and their employees on a lot of different bases without any constitutional or statutory problem whatsoever. The third and fourth are about bearing witness, speaking, being able to object. And so Michael mentions earmarking, right? We're requiring the employer to earmark. And Melissa says the main objection, and I think Melissa's getting at what was really at the heart here, was one of 2 things. Either the employer will, as Michael suggested, be seen as actually sponsoring or endorsing the use of contraception because it's in the plan that they make available to their employees. Or just that they won't be able to speak by discriminating against contraception, right? That to actually say, here, you're entitled to every form of health care in the world except these 2 or 3, actually does speak volumes about the intensity and the importance of their objection to contraception. And this does, in that sense, eliminate their ability to engage in that kind of speech by action, by discrimination. But I want to suggest that both, I'm not sure that those would be substantial burdens under the law, but also that the new compromise mostly takes care of both of those problems. I don't think there's any problem about endorsement. Michael has famously and correctly and vociferously for more than 2 decades argued that when individual choice, that when genuine and independent individual choice is what is the determinant of how the money gets used from when it's coming from the state is not, no one would understand the state to be endorsing the individual's use of that money for those purposes. That is even more so here. Even under the old plan, the employer simply says, instead of I'm giving you salary, as part of your recompense for your labor, I am giving you access to Aetna's health care plan. And it includes everything under the sun, including this. No one thinks the employer in that case, particularly where legally compelled, endorses every form of health care under that plan, right? And says these are all good for you. Particularly whereas here, and as the new advance notice points out, the employer is free to shout to the heavens and to its employees, we have profound moral objections to your use of this plan for the following reasons that we have sincere and deep religious objections to. There is no possibility here that anyone will doubt that the employers in question here are opposed to the use of contraception. If there was any doubt before 3 months ago, there's not anymore.
So
okay? But let me get to what I think is the most critical one, the one Melissa and Helen both have raised, which is this idea that the employer here is not being able to discriminate, and discrimination itself speaks volumes. I do think, Michael, that the analogy to Rumsfeld versus Fair is a powerful one. The law schools there were basically saying, look, we're against discrimination on the basis of sexual orientation, and we exclude employers who discriminate in that way, and that sends a powerful message to our students about the depth of our opposition to that practice. And when the government comes in and tells us, as it could tell religious schools as well, you have to have the military recruiters on campus, it will prevent us from demonstrating the depth of our objection. And the court basically said, you know, that's fine, but too bad, right? You have to do it in other ways. The state is not required to allow you to violate the law or to have an exemption from the law in order to promote that form of speech. A form that I might add would have to be increased, you know, exponentially here to include virtually anyone with any profound moral or religious objection to any form of the health care that they're required to provide, right? It's a very, very large hole that you'd be blowing through this. Not that I find that to be an insincere or unimportant objection. I think it's a very important one. I think the law schools were right. I think the religious organizations are right. It did send a powerful message when they excluded contraception alone from all of the forms of health care to which you were entitled. But I don't think that the law requires that kind of exemption. And most importantly, I do think that the new compromise just gets rid of that problem altogether. It's not the same plan. It is a distinct plan being provided not by a new entity, but by the insurer or by the administrator who's already doing it, by Aetna, right? And Aetna or Blue Cross is providing you this, and you're now we don't have earmarking or the association of the employer with the contraception services at all. And so I think that the administration has quite appropriately gone to great lengths to address most of these different kinds of religious objections.
Okay, so let's leave that particular issue on the table with the great debate that you all have to write about in the next few weeks. And just a note, Tom Farr gave me permission to go until we got started about 10 minutes late, so we'll go about 10 minutes over. So we'll have a few more minutes of conversation, and then we'll open it up for Q&A. I want to ask now the question about, well then, so what? Let's assume there is a substantial burden. Let's assume the current state of law. How do we fix this? How, if there is something to be fixed, how do we fix this claim of harm? Do we push for a redefinition of the religious employer to broaden it? Do we follow the Blunt Amendment and let anybody who has any objection whatsoever exempt themselves? Do we further attenuate the causal chain? What would fix the problem? I will give you one suggestion that I've heard, that it was interesting to watch the objections be raised, and the administration, this gets to the question of how much deference to the claim of harm. It was interesting to me to watch the religious claims of the administration, or the religious claims of the Catholic Church, for instance, be cognized by the administration in order to then make the revised mandate, and not necessarily, as the bishop suggested, that there was no real conversation. It was sort of like, well, we went out and we read Vince Miller and some other kind of moral theologians determining where the line is in proximate material cooperation, and we drew it here rather than asking the bishops. But that raises the question of, should the government be simply deferring lock, stock, and barrel to any claim of harm that comes along? So,
just one thing that actually plays off of Marty's continued statement that we're blowing a hole through this sort of guarantees of various kinds of health care to people. Just remember, and I don't even have the list all in front of me, but I have it in my voluminous bag if you're interested at some point, that there are already a wide variety of federal laws that ensure that we're not going to all of a sudden have people refusing to provide health care insurance for people based on things like disapproval of their lifestyle or sex or race, which are the kind of big problems that were kind of raised by members of Congress who oppose religious exemptions here. We have the Pregnancy Discrimination Act, we have the Civil Rights Acts, and so forth. And remember that the idea that somehow we're trying to, quote, roll back protection for women's health, we're trying to roll it back to something like, I don't know, last July, which is when all these existing conscience laws, and again, I do have a list of those here, but in limited time I won't read them. Bill Clinton signed 9 different pieces of conscience legislation during his term that included the kinds of terms in the Blunt and Fortenberry Amendment. Hillary Clinton proposed it in her own supported health care bill. Not hers, obviously, but the one that her group was understood to support. We are not talking about a situation where the sky was falling and the government had to prop it up again by putting together this preventive health care mandate. We had the vast provision of health care by both public and religious and other private entities, and there was not a sky is falling situation with women's health. There's also one thing I want to draw, the difference between the statements that would be made about the nature of the compelling state interest and therefore what kind of exemption should be granted. When you're talking about an individual person using birth control of various forms, you have different kinds of method and use effectiveness. And on an individual person level, it's definitely associated with a reduction in the likelihood of getting pregnant when you don't intend it, when it would be mistimed, when in some way it would be correlated with some other problem in your life or the child's life. But as a social policy, as a government-supported policy, it simply doesn't have the data on its side to show that the government has any interest in closing this tiny gap to the extent one exists between its availability July and its availability in August 2013. The data just isn't there. There are other factors than contraceptive availability in actually affecting rates of abortion, out-of-wedlock pregnancy, sexually transmitted disease, and unintended pregnancy. The government programs have never correlated, except some short-term programs on limited populations, but never over the long run with an improvement in women's health by these measures.
Let's assume the data is there, because we're not debating the epidemiological.
Well, but I think that goes to the compelling state interest, and the government doesn't have any data on its side in the long run.
Let's assume that the legislature, and we all know that Congress and other legislatures act in ways that set compelling interests, or set legislation and policies, and the data is always questionable. But let's assume, for the sake of the rest of the debate, that there is a compelling interest,
and there is a harm. Extant federal laws and saying that if there is, assuming there's a compelling state interest, it still is belied by the fact, the evidence against it, by the variety of conscience protections that existed up to this present time would say, what is that compelling interest?
Michael, you have written extensively about the fact that there might be a constitutional necessity for exemptions in a broad range of circumstances. Your sort of wonderful law review article back in the, about the free exercise of religion and making the claim that there is a long history of exemptions within the colonial and the founding era and in the early states. How does that apply here? Particularly after, most of these conversations end up, I think, talking back and forth between persons who are very aware of the modern jurisprudence and all of the very subtle claims versus a kind of general conception that, but the Constitution protects free exercise. So what's your best claim about this, and then how does the modern jurisprudence alter that view?
Well, so you're asking a question about the legal landscape.
Yes.
Up until 1990, in the peyote case that a lot of people are familiar with, The constitutional rule was that which was set forth in Wisconsin against Yoder and Sherbert against Verner and many other cases, that the Free Exercise Clause prohibits the government at any level from imposing substantial burdens on the exercise of religion unless they serve a compelling governmental interest. In the Peyote case, the court said, no, after all, that isn't what the Free Exercise Clause means. Now, my scholarship to which you refer suggests that that case was wrongly decided. Nonetheless, it was decided, and that is the current doctrinal position of the Supreme Court. But that wasn't their final word. In Church of the Lukumi, Babalu I versus City of Hialeah, and then especially as elaborated in a lot of lower court decisions based upon that, when the government has already created a number of other exceptions from its law, then it is not a neutral and generally applicable law, and you return to some kind of a strict scrutiny. And again, as I commented before, this particular mandate is riddled with exceptions, the most obvious and glaring of which being the grandfathered plans exception, which serves no important governmental purpose at all other than a political one of allowing the president to say that people are keeping the same plans that they had. If millions of people can be deprived of this important coverage in order to satisfy that purely political concern, it seems to me that that indicates that the free exercise of religion is going to be violated by not extending a similar exemption to religious conscience. Then, in addition to that, RFRA was passed 1993 in response to the Peyote decision, and it applies to actions of the federal government imposing the same earlier test. And now, a few months ago in the Hosanna-Tabor decision, the court has bifurcated the Peyote decision and said it only applies to the outward physical acts of individuals, and whereas the internal decisions of churches with respect to matters of faith and mission do have protection against neutral and generally applicable laws, like the even extremely important ones, like the anti-discrimination laws. Now, we do not yet know quite what that means. The internal church decisions, the court, there's going to be a lot of litigation working out exactly what that means, but we do know from Hosanna-Tabor that it includes, to some extent, relationships between churches and their employees, because that's what the case was about. And I would say that this mandate is simply telling churches that a mandatory term of employment between them and their employees is that they must provide, as part of the compensation, if they're going to have health insurance at all, they must provide something which is contrary to the teaching of the church. And I do not think it's at all far-fetched to think that that is an internal church decision which will be protected under this new line of analysis as well.
Great. So Melissa will have the last word of the panel, and then we'll have time for a few questions.
Just a few quick points. The Hosanna-Tabor decision, which I also welcomed as Professor McConnell did, relates to religious communities and their ministers, not all employees. So I think it's important to bear that in mind in terms of thinking through this question. Secondly, just want a quick shot at how to address this problem. I would like if the administration would redo the employer definition that it has, the initial exemption, which I think is faulty. It doesn't seem to be going there. Short of that, I think that what it can do and is in the process of doing is making the accommodation as much like the exemption as possible and equating the two, minimizing the differences between the two. They have talked about in the latest notice that religious organizations that would be covered by the accommodation but not the exemption are just as authentically religious, no less important. They've also said that they won't they'll let people self-certify that they are an accommodated entity so that I would be very nervous about the government going in and asking intrusive inquiries about whether an entity was an accommodated entity versus an exempted entity. And they've said they won't extend this to, other areas of federal law, which is very important. Obviously need to watch that very carefully. I also think the administration has been trying to build this distance between the employer and the objectionable coverage. It's made some significant steps in my view, but there's interesting things being done about those for whom the accommodation is not adequate. And some conversations about exactly what Professor McConnell mentioned about government's role in providing some of these benefits that might be more acceptable to some who view the accommodation as still working a substantial burden on their free exercise rights. So I just say, I hope that conversation continues to develop in a productive way and takes into account various understandings of what would be a burden on free exercise.
Great, so thank you. And we have time for a few questions. I really ask that you keep these succinct and that there's a question in there. So, sir.
Yeah, thank you very much for your panel. I was surprised, though, that none of you spoke to future Health and Human Services secretaries. It would seem to me, since they've already changed because the current HH secretary has changed how it applies, it would seem a future Health and Human Services secretary could either decide to withdraw the exemption to churches themselves for a compelling national interest, or a future HH secretary could decide there's a compelling interest in saving Social Security, and so we need to withdraw contraception altogether because we need new employees to support people who are retired. Why is this not a constitutional hash that a HH secretary can change, as she has, and future HH secretaries change it at will once again, and then again, and then again?
Okay, thank you.
Well, the statute itself gives the HHS secretary discretion of two sorts that are relevant to this. One is the discretion to define what preventive services are, and a future HHS secretary could easily go back on this entire mandate under that authority. And the other is a provision that gives the HHS secretary the authority to, I forget exactly the way it's worded, but to provide religious accommodations and again, that's a discretionary matter. Now, you're horrified that the HHS secretary can do this. This actually lands in another one of Marty Lederman's academic specialties, which is separation of powers, but this goes under the rubric of the non-delegation doctrine, which doesn't exist. And currently, much of what the government does is simply cabinet secretaries exercising discretion that they've been given by statute, and future secretaries can do the opposite. And if you don't like that, I suggest you write your congressman, and I'll be happy, and I'll sign the same letter because it bothers me too.
Galen Carey with the National Association of Evangelicals. On Melissa's point about the precedential impact of the narrow definition of religious employer, how much weight should we give to the administration's statement that they're not going to ever use this again for anything else? And how much danger is there that in what areas of law would you particularly see this being perhaps applied as a precedent?
You're talking about the four factors? Yeah. I mean, I frankly think that neither they nor the states that have used them have quite ever explained why these particular factors. I suspect that HHS took them because they were time-tested in litigation in New York and California. Like Melissa, I'm not sure they are quite the right factors that we should be using, and it's worth discussing how you might better craft it. Is there anything to ensure that those four factors won't be used by any governments ever again? No, there's not, but I think as HHS notes, and as many of the panelists have noted, religious and moral exemptions come in more than 31 flavors. They come in a ton of different variations. Statutes, regulations, and the like at the federal and state and local levels are crafted in 1,001 different ways. It's actually a topic that deserves more academic attention. Legislatures and administrators the hugely wide array of the manner in which they craft religious exemptions. And I'm not sure that this 4-factor test is going to have any more traction than any other. I don't see it particularly.
Yes, ma'am.
I'm kind of surprised that people are sort of accepting the notion that contraception is sort of uncontrovertibly good, even on a non-spiritual level. I mean, the Catholic Church is getting attention because they have spiritual objections to it, but there's a National Cancer Institute issue. I'm just going to, I know I'm going to make a question.
I think Helen actually pushed this line pretty hard.
Okay,
and we're not
finish.
debating contraception and its
No, but I'm going to tell you that you're accepting a paradigm that assumes an analogy, perhaps, that is inappropriate from a scientific perspective. And I wanted to know, because you're looking at this like an OSHA reg, and it's not. I mean, OSHA is pretty incontrovertible in terms of what is or is not safety for an environment, an employment environment. But when you're talking about women's health, okay. I mean, if a Methodist school that was a dry school that prohibited alcohol let some liquor store come in and distribute flyers everywhere for free alcohol because it brought people in, then they bought peanuts and other good things, people would think that was ridiculous, right? So which is the more appropriate analogy?
Well, I don't think your analogy actually works. Ma'am, yes.
So I was confused by Professor McConnell's discussion of the Hosanna-Tabor case, because my understanding of that case is it was fairly narrowly limited to the situation of when an employer can decide who a ministerial employee is. And so I wondered how it would be applicable to this situation.
We don't know how, the specific case was about the ministerial exception, but in the court's explanation of why the free exercise clause extends to that question, the court had to distinguish employment division against Smith, the peyote case, and explain why this neutral law of general applicability violates the free exercise clause. And in doing so, it used very broad language. That is, it confined Smith to what it calls outward physical acts of an individual, and it said this is different because this is the internal decisions of a church that have an impact on their religious beliefs and mission. And then in the next to last paragraph of the opinion, the court says, essentially says, we're only deciding this case, we're not commenting on what its many ramifications might be in other areas. When they say that, when they say we're not deciding these other things, that is actually not the same thing as not commenting on it. What they are saying is this is open for lawyers and lower courts to consider on a case-by-case basis, and we're not going to pretend that we're smart enough to anticipate all the possible ramifications. But that's why Hosanna-Tabor is broader than just the specific ministerial exception
Ken, we have
context.
we have time for one more question. Is there a student who would like to? Great, we have a winner.
I hope we have a winner for 50 grand a year. Kieran Raval, Georgetown College, 2013. I would just like to ask how you see the so-called compromise addressing self-insuring religious institution or Catholic insurance companies coming out from their rights of conscience, their religious liberties, especially I'll point to Archdiocese of Washington, self-insuring Catholic institution. How do you address that?
My understanding of what HHS did, they said two things with an opening for much more discussion on it. The two things they said are, first of all, to the extent you've chosen to self-insure, which basically means that the employer, rather than the insurance company, decides on the terms of the plan and hires the insurance company only as an administrator rather than as the creator of the plan. You don't have to do that, right? So if you find this to be a burden and you want to get out of it, you can always choose not to self-insure. But secondly, that the administrator that's chosen, which would typically but not always be an insurance company, the ones who actually administer, for instance, Georgetown's plan, they too would be the ones that would be providing these services, this compensation in a separate sort of plan. The rule does not spell out what the statutory authority theory is for this, and I think there's a lot of work that needs to be done going forward. Or maybe there's not, but I don't know the ins and outs of the statutory questions, but I think that they are less certain about how that will look than about how the other cases will look.
If you'd like to take a look at that, I have the Friday night and not what's published officially yesterday.
It's the same, yeah.
But one of the interesting things they also proposed, in addition to what Marty just described for the self-insured, which to me still doesn't cure the problem of the government, however they set up and fund this entity that comes in between you and your employees. But they even talked about something which I think happened when San Francisco required domestic partnership benefits for Catholic charities there, which is Catholic charities say, well, hey, we like extending health care to other people, so we'll just say you can extend this to any other dependent in your home. And we'll just provide that. One of the things I think I caught in the HHS proposal on Friday night was maybe there's just going to be an extra pot of money that a self-insurer is going to put by, and you can use it for this or other things. And this would go along with what Blunt and Fortenberry were saying in their proposals, which was, we're not going to allow people to make religious excuses to cover less in insurance than they otherwise would, whether they're self-insured or using an outside insurance provider. And so you're going to have to provide the same value. And they're thinking, maybe we can just do this with dollars. So that, to me, was the most interesting of the proposals put forward, because it's neutral dollars.
Yeah, I read it as being certain government benefits. So the government would end up effectively paying for it because you'd get exemptions from other things, but it wasn't entirely clear.
Yeah. No, it wasn't entirely clear. We can totally end on that agreement.
Consensus.
That's a virtue.
All right, well, thank you very much, and join me in thanking the panelists.
Well, that was a terrific discussion. Thank you all for coming, and I hope you'll stay in touch with us on our webpage, berkleycenter.georgetown.edu/RFP for the Religious Freedom Project, or you can just Google Religious Freedom Project at Georgetown. Thank you for coming.